Well, good afternoon and welcome to the weekly summary of COVID-19. Today we have Leo Sarkisian as well as Janet Rico joining us. So thank you for attending. We'll leave questions to the end. So take it away, Leo.
Thank you. Thanks, Carrie. And I'm going to introduce Janet in a couple of minutes. Many of you know her already. And I want to just start off the program as I usually do. First place, what an unusual Patriots Day. This feels very odd as we all start the day. It's like every other day of the year right now, and a little bit like Groundhog Day, except it's given the surge that we're in the middle of, it's pretty serious drama. And I mean, the good news so far from anecdotally what I've heard in our community is it really varies across the state, the situation, and we don't have any hard numbers. We're hoping this week sometime we'll get an update on numbers. But of course, we're all worried about the impact of this serious virus, and clearly there's a number of issues we're working on. Today's topic especially is apropos, right, to this concern about making sure we get the best health care possible to achieve health equity for people with disabilities and, of course, people with intellectual and developmental disabilities. So let me start off with, and I'm not sure if people like this or not. I always do like a slide of what the status is after a week. To my feeling, it's slowing a little bit, but of course it's still growing. When I say slowing, it's not the huge jumps we saw in the early weeks. However, if you look at the deaths, that still continues to, in this case, more than double. Of course, in the early weeks, we were seeing much higher multiples because of and especially the comparisons to the total cases. Total cases have gone up about 13,000 since we last received the information. This is information from MEMA again, for those of you that are new, and it's information as of yesterday, late yesterday. And then there's the testing has gone up by another 50,000 people, a little under 50,000 people. So everyone in our state, in New York, Mayor de Blasio was on last night. We really need the testing. And of course, for people with disabilities, when staff come in and staff go out, you want to have the testing, but again, testing's not the complete answer either, right? We're not going to have a complete answer until there's a vaccine. Just a quick, before we get onto our topic, just a quick key issues update. Equity in healthcare, which is our topic today. That still continues to be an issue. And as you know, we joined a group early on led by, coordinated by Center for Public Representation. And after some outreach and joint letters and outreach to our policymakers in the administration, work was done on a complaint. And then after that, we discovered a broader group, and we're going to talk about that as well as the other group in a few minutes. And we worked with them. Now we're waiting with some trepidation and some hope that there'll be some revised standards of care. So more on that when Janet talks about it, and we have a discussion about that in a minute. We're working on further financial support for residential services. It's an alert right now. It's live. So if you go to thearcofmass.org, take action. There's an alert for this to the governor, the speaker, and the Senate president. There's an alert for legislators. And then there's an alert on the healthcare triage. And then thirdly, we don't have an alert yet for this. We have been, I think it's sent in at least 2 letters about additional assistance for individuals and families at home. There's really 2 levels to this. At some point, I think we're going to need help getting more staff. I don't know if you noticed the MEMA site, they were already trying to recruit for people for congregate care settings, but large ones. And so clearly they've been having issues, not just at Holyoke, but elsewhere. I think that might be something we may need, as people go through this day in, day out, 24/7 care as a parent or a sibling or other family member or in shared living or AFC. And then special education, this is the big week for that. We're hoping we're going to see more cross-state implementation. It really requires, I think, bullet 3, the additional assistance, to really make it work for some of our folks, right? Some of our constituents need that additional assistance. It can't just be over. Yes, you could have virtual or video education, but you need someone at home and not just the parent who's sort of on for 24/7, right? To help make that come to life. And then retainer funding for day and employment services, that shouldn't even be up there. That was committed to some weeks ago in late March. That has not yet dropped. And of course, some of the agencies that have homes, they've deployed their staff in day programs and other staff that aren't working in homes are doing other tasks, outreach to families. And finally, for PPP, not only do we need Washington, D.C. to get moving, to get plenty of PPE out there, right? More than what we need. We're going to eventually need local outlets because families have said, hey, I need PPP. I'd love to have mine at the door so when someone walks in, they know to wash their hands, get on the PPE, put on the mask, so on and so forth. So this has been discussed. This was been outreached on. And then recently we joined a call to Attorney General on Friday where we talked about the local outlets piece, and my colleagues, Charlie Carr, Bill Enning, and actually someone I'm spacing out on their name who uses a PCA also brought that issue up about individuals and families wanting to have the PPE at their house. So you're going to have some kind of local system. Fire department seems the most logical, even though, nobody wants anyone entering. So that's the list for this week. The list, as you can see, hasn't changed much. There's been progress over time on some of the lists. And of course, the administration has made more flexibility around PCA services, and you can use home health if you can't find a PCA. So it's things that we have links to on our site, COVID-19 at thearcofmass.org, that you can see those guidances, as well as a recent letter from Commissioner Ryder that this week's update will have a link to as well. So now I want to introduce Janet Rico, who not only has served on the board of the Arc of Mass and will be actually serving again soon, but she is chair of the Arc Steering Committee on Policy and Advocacy. And she has a degree, PhD in health care and law policy. And I know I'm cutting it off. It's probably longer than that, but it is healthcare policy. Right. And she's a nurse practitioner. Yep.
We haven't heard anything from Mass Health on day program stuff.
Correct. So just before I get into the main topic, sure, good question. And so we were told this. Okay, just to be clear, here's what's happened. I don't blame you for being concerned, and I'm glad you spoke up about it. ADDP, which is a trade organization, and ourselves had a call this week. Not just with DDS, where again, Ellen's been consistently raising the issue. She's a CEO of ADDP. We expected some of the money, and you did, I'm sure, for the money to arrive sometime early this month. I had heard April 6th, later April 13th, from DDS. And then in terms of Mass Health, I thought it'd be in the same ballpark. So I've been told now from administration sources that they had intended to drop the retainer fee by the end of the month. And the reason that's important for those family members and others on the call is organizations might have already been forced to furlough some or all their staff because that was the revenue that kept things going, but they also have rent to pay. They also want to be prepared to reopen the day programs when people slowly start coming back. So, and there was a commitment made for those payments for not 100%, but a significant amount. And so the expectation right now is there'll be something coming out this week, the money dropping the last week of April. That's what I know up to this point, but I will get a note on that. Is this Rick?
Yeah,
Rick?
it is.
Yeah, good. Yeah, so I'll get a note out on that again, but I don't blame you for being concerned. And also the Department of Developmental Services dollars haven't dropped yet, despite, I've got to say the team there around the money, not only from the leadership of the commissioner and her team, leadership team, and the folks that work on this, like Nick Dancer. I mean, if you talk to Ellen, they clearly have been working hard to try to get those dollars out to people. And so the hope is there's a glitch. They're going to resolve that glitch in a few days, and it should be resolved. The intention is to get the money out in both cases. So just to be clear.
Another question, Leo. I'm assuming that's.
Rick, let me ask you to wait till the end, only because I want to get Janet on, because she's still working full time, as well as helping us on the volunteer side, as well as doing other volunteer work. So just bear with me, okay? And I promise I won't end the call till I answer the other question. What's great about Janet, in addition to being a parent, she has she studied long-term policy, long-term support policy, and healthcare disparities. So that's why it's a pleasure to have her on board. She's also on the board of Fallon Healthcare System, and she has been involved in this work and also representing us as well in terms of, what equity. And so first, we're expecting a revised Christ Standards of Care with some hope. Yeah. But I'd love for you to talk about how you've joined, the broader coalition and what that's about, and goals that make sense with our goals.
Yeah, great. Well, this is has nothing to do with me at all, and I thank you for the slide, but I really don't want to.
I know.
Anyway, no, it's not. So just so you're aware, I'm also a nurse practitioner. I work at Mass General in the emergency observation unit, and had a daughter who was very medically fragile with IDD, intellectual developmental disabilities, who passed in November. So sort of lived that complex medical care situation for quite a while. So in the beginning of April, actually it was April 6th, I believe it was, Leo, we were on a call with the state, and they were describing the crisis standards of care document, the guidelines for each hospital in the state to make decisions about how best to allocate ventilators and ICU beds in case our hospitals were becoming overwhelmed with the COVID pandemic. I have to admit, as a practicing nurse practitioner and a parent of a child with significant disabilities, it was very frightening to me to read it, but I also understood that there needed to be some kind of guidelines for practitioners out in the field. But some of the things that really were disconcerting to us, and for those that are really advocates for people that are marginalized, like the poor, minorities, and certainly people with disabilities, we're very concerned about the fact that they were looking at comorbidities as well as life years saved, as well as there was a note also about your employment and whether or not you were either a health professional or responsible for societal order. So to be really honest with you, I know Leo was just feeling the same way. We were very concerned, and I ended up being on a number of other calls, and one of the groups was the Mass Coalition on Health Equity, which for me as a parent, and speaking as a parent, I was very heartened to see a number of physicians from across the state, from partners, from a number of other organizations, social workers, some attorneys who were on this call, and were calling for, were concerned just as we were about, potential disparities and implicit bias coming into clinical judgment when we were possibly having to look at allocating ventilators and ICU beds. So to that end, I've been meeting with this group, as Leo says in the slide here, it's the Mass Coalition on Health Equity. And this group has actually made a recommendation to the Executive Office for Health and Human Services to look at getting rid of comorbidities as being part of the scoring for whether or not someone would get a ventilator or an ICU bed, getting rid of life years saved, and really looking at whether or not very specific things that would be for immediate or almost near immediate death. For instance, someone that's had a heart attack and they're not responding to treatment, someone that has metastatic cancer and has less than a year to live despite a lot of aggressive therapies, very specific things that would be called into play in making that decision. And to get rid of the employment, whether or not someone was a health professional or responsible for societal order has nothing to do with making a decision about whether or not someone should get access to critical care. So that's the work that's been going on. I know Leo has been incredibly supportive. The ARC has been incredibly supportive of this.
Janet, you know what I want to ask you? Like that was yet another group we joined, right? Later on.
Yes.
And originally Maura was representing us on the, the group that ended up developing a complaint, right?
Right, the complaint. Yes, that's right.
That was more
2 groups.
disability focused. And you sort of got at this early in the talk that you were the breadth of physicians and nurses and other clinicians that were part of this group. At first, they were looking at more other at-risk populations, correct? When we first joined them, were they?
Right.
So
They were. I mean, they were looking a lot at, minorities, Black, they call them Black and brown individuals from the poor, homeless, and then we brought in the disability, the fact that people with disabilities need to be represented as well, and so that's been the work that we've been doing, and they've been, again, very supportive of our work. And you're right, it started as a bigger group, and I think bringing the physicians into the group was really important for us to do that.
So that gives us hope. Like I think early on when the three of us were looking at this, right? Was just about, people cared about people with disabilities. And then it turned out, my God, the numbers came out, right? For people dying that were higher for African Americans and other populations. And and we haven't gotten the same level of press, but I think there's been a little bit of recognition. So I think, I mean, are you hopeful that this kind of coalition is more effective, you think, because it's broader?
Well, I think that first group, what came out of that was an advisory committee that were making recommendations to the Executive Office for Health and Human Services, and those the revisions should be coming out tomorrow. And I'm very hopeful that if Dr. Thea James from BMC was one of the people that is representing, one of the representatives. I'm really hopeful that these suggestions, these recommendations will, be heard by the governor and by Secretary Sutters, and that they'll be implemented. They were looking at the guidelines from New York, which seem to have been some of the guidance for us. And we're just, again, hopeful that, that they'll listen to this and they'll hear us. I think one of the biggest concerns from some of the physicians, which I really hadn't thought about, is that one hospital system may say that they're all set and they're going to be able to run this out with their modeling. But we're thinking about, what's happening statewide, and will there be transparency of how many ventilators, how many ICU beds each hospital has, so that, say, a hospital that doesn't have as many resources will be able to get shared resources,
Yeah, so
and that's a concern.
I was surprised about that one of the themes, and then I'm going to move you to the next topic that's at the heart of many people on the call, but I was surprised when it came up. I get the group emails like you and Maura do, and I saw that one of the, I forget which, if it was a physician or an administrator, said that sometimes they aren't transparent about extra ventilators, right? So it's issue of insurance is part of the problem, right?
That's one of the biggest things, right? Exactly. A smaller hospital may not have the resources, and it may be in an area that's really, has more people that are disadvantaged, and they wouldn't have the critical care access. So.
And maybe a hospital wouldn't tell them about what they. And
the other thing we're asking for is our data about how many people of marginalized populations are being seen, and how many. We want that data, and we want to be sure that that's also transparent as well.
So let me segue you to another big deal that's in this CPR letter that the other coalition that's our beginning coalition, and will be our sort of, is our close ties coalition with the disability groups, including the MAMH and IL centers and others that are long-term partners. I think that families is involved too, and other groups. So on that, one of the biggest things on that at the end of it is the accommodation issue about someone going in, and some of our chapters have reported early on in Berkshire, like they could not get even information at first, once the person was admitted. They've had, by the way, thank God, people have been coming back. They had an early, they were early on in this crisis, and that was great news to hear people returning, right, from the hospital.
Yeah. One of the biggest concerns is that your loved one could be admitted to the hospital, but you wouldn't be able to go in with them. And that's pretty much the way it's running. They do not have the PPE to be protecting, having visitors come in. So what will we, advocate for when we need to be with our loved ones? So I think that's something that, the ARC's been very vocal about, and a number of other groups have been very vocal about, that we need to have that accommodation. And, they need us to be in there with them. So
what do you suggest that you have during this interim period? I mean, we're hoping there'll be a case-by-case allowance, right? We're keeping our fingers crossed, praying for that. But do you have any suggestions, someone who's been in, a place like MGH?
Yeah. Well, I was just talking to another family member right before I got on this call, and, I know how it was for me. I needed to be in there, and they needed me to be able to communicate for her, to be her advocate, to be able to tell them, what she needed. And so I think that we need to just say that we really are part of their care, and we need to be directly one of us. It may be that they'll only allow one, and that's fine, that either a parent or a guardian has to be there, and that there could be errors occurring if we're not present. So I think that that's really, really important.
You have hope that could happen even without a guidance. You have, I know a couple of weeks ago, Maura hit this topic, and one of the suggestions, one of the things she had talked about was a PCP writing a letter, to document the need.
I think that's a great idea. And I think the other thing folks could do is many of the major medical centers have a disability center. They have someone who's an advocate for disabilities. I know at some of the bigger hospitals that you need to talk to them.
Right. So actually, right, BMC and MGH.
Yeah, MGH and Brigham and Children's.
Yeah. Okay.
Absolutely. Yeah.
So we could lean a bit on our friends, especially like I was thinking the university centers were very tight, but then we have other people we're tight with at other centers as well. Maybe we should be talking to them. That's great. Okay, Carrie, do you want to handle the chat, Carrie? We should shift to, let's give people some time for questions. This was really helpful from my perspective.
Oh, thanks, Leo. Thank you.
So hang in there for some questions. And I know you got a busy day. I really appreciate you making
no, I may not have the answers, but I'll.
So, thank you, Janet and Leo. Anne, would you like to unmute yourself and ask your question?
I have a comment. New York has changed their policy to letting people in when they need an interpreter or somebody to be with them. And Massachusetts self-advocates, Mass Advocates Standing Strong, and the self-advocates in Massachusetts have started to advocate to have that changed in Massachusetts as well. We've written letters, and we realize how important that is, and we're starting.
Excellent.
Thank you, Anne. Thanks for doing that. That's great.
Thank you. And Maura made a comment here. Want to mention about our direct letters going out to the hospitals and the trainings on the website.
Okay, great point, Maura. I was, you were right, I skipped right over that. So there's an alert on the website. By the way, as of today, let me see if I can pull up there was 1,000 something, and I can't see the Word file. Katerina sent it to me. Over 1,000
strong word
that have gone in on healthcare triage to the governor's office, requesting changes in the standards, including the accommodation that Janet was just talking about. And then secondly, we were so nervous early on. Three of us, with some help from others, discussed what's a strategy. So we developed a web page that we will be sending you an e-toolkit as families and staff in the field and self-advocates that you can also send to your local hospital. And the e-toolkit has it's a 50-minute awareness page on our website. It's the arcofmass.org/triage. You can see it right now. I don't think we have a link to it yet, but it's good as it is right now. Basically, it has 3 videos. The videos are under 6 minutes, the 3 of them together. They give different slices, including a gentleman with spina bifida who works at an accounting firm. But then there's, persons with intellectual developmental disabilities in the other 2 slides. And then there's pictures of individuals with disabilities, including a lawyer who happens to have a brain injury from Biama, joined us and posted that, which we appreciate. And then we're loading it up with 5 or 6, 7 more stories, including Jonathan, Diane Huggins' son, Jonathan agreed to do it, and little vignettes right under a few sentences about what a good life they lead. And yeah, they happen to have comorbidity, they have an underlying condition, but that shouldn't stop you from treating them. So yes, thanks, Maura, for highlighting that and mentioning
And that would be helpful for a family that, you know, if they're feeling that there's any chance of implicit bias in decision making, to actually show them the link. You know,
Yeah.
I mean, I think it's really important. So
we're writing to 20, we're individually writing to 28, faxing or emailing when we can find the emails. But we want it multiple. We want multiple reinforcement of this. So we will be giving you an e-toolkit, and we'll advertise it in the next 20, you know, I'm sure in the next 24 hours we'll start promoting that. But it's Charlie Fisk and Vicki Allen, Vicki's our grad student intern. I asked her to start early for this semester since she's technically not interning right now, to help us track down the ID information.
Okay, anyone, other questions? Who wants to chat in?
And then I know Rick had another question, but he might have left, and he'll follow up with me, is my hunch.
I just want to say that I've just been really very heartened. It was very heartwarming. It's been really heartwarming to be on these calls with this group of physicians, and I just realized that you know, I'm very hopeful, very, very hopeful that that things are going to work out the way we want them to. I really am. But it's all because of people like the ARC that are really speaking out. So thanks, Leo.
All right. Thank you, everybody. I think that's, we try to keep it to 30 minutes. So you guys have enough. And then the other sessions coming up Tuesday.
Thanks, Ann, for all your work. Thanks, everyone.
Yeah. Take
Bye-bye.
care, Janet.
Thank you.
Tuesday, there's 11 a.m. with Perry. Thursday, 11 a.m. with Maura on state update. And then Fridays at 12 noon, there's a federal update. And I'm not sure in terms of guests. I'm pretty sure next week I'll have Reverend Bill Gaventa, who was for decades building themes of faith communities and people with intellectual disabilities. So I'm hoping he said yes, but he confirmed with a sort of caveat. So hopefully he'll be on, but we'll have other guests coming that Carrie's coordinating with our hosts. So, and hostesses, host sounds better. So thank you, everybody.
Okay, thanks.
Thank you,
Thanks,
Leo.
Leo.
Yeah.
Thank you.
Thank you, Leo.
Stay healthy.
Same to you.
Take care.
That's some good information there.